Hi, Facebook friends. Good morning. Happy Tuesday. So happy to have some time with you this morning on YWTV. Another wonderful episode to engage and educate and inspire you today. Today, our focus of our discussion is going to be about women's health, a very, very important topic. It is no secret that women are usually very focused on taking care of everybody else in their lives. We take care of our children, our spouses, our parents, very often neighbors, friends. We naturally just kind of collect people and care for them. One person that sometimes doesn't end up on the list, though, is ourselves. It's not uncommon to kind of push our own needs to the bottom of the list and say, oh, I'll get to that, when I can. But today we're going to talk about putting ourselves back to the top of the list, prioritizing our health a little bit. And we are going to do that with Dr. Rizk, who's the medical director for Ambulatory Services at Bergen Newbridge Medical Center. And so happy to have her with us this morning as we talk about our own health as women and well-being in order to live a happy and fulfilled life. Who doesn't want that? Personally, I had the opportunity to get to know Dr. Rizk last year. She, almost a year ago now in December, was one of our twin honorees, which is a annual event where we do a tribute to women of influence in our community. She has such a strong commitment to ensuring that all women take care of themselves. And I was so struck from our conversations that we had that I knew I wanted to get her involved in the YW and have her talk to women in our community. Before we chat with her, though, I want to tell you a little bit about her. She, in addition to her role at Bergen Newbridge Medical Center, she is also an assistant professor for the Department of Obstetrics, Gynecology, and Women's Health at Rutgers, New Jersey Medical School. She also is well-respected and published leader in her field. Her innovative approach at blending health and wellness to the management of women's health issues has brought a new dimension of treatment options to patients and communities served by the medical center, while also filling a much-needed gap for care that has been identified in Bergen County. We are so lucky to have her local to us. She is, in addition to all of that wonderful work that she's doing, she's very active in the medical center's Diversity, Equity, and Inclusion Committee. And so with that, I welcome Dr. Rizk.
Thank you so much. I'm so happy to be here. Love speaking to women and making sure we all get on the same page of taking care of ourselves.
Yeah, it really needs to become a changed mindset for a lot of us, doesn't it? Myself included in this discussion, for sure.
Absolutely. It's very important for us.
So why is it that we still, with all of our caretaking, tendencies and we know this, right? We know we need to take care of ourselves or we can't take care of other people. But, why are we still constantly in the position of always reminding ourselves and reminding women around us that they need to prioritize their own needs and care?
I think for us, we're still not sure of what it is to be well and to focus on women's wellness. And I don't think most of us really understand the wellness part. So we only go to the doctor when we feel something's wrong. We take care of our kids' yearly physicals and school physicals and sports physicals. We take care of everything else around the house, and especially with COVID locking down a lot of things, everyone's more focused on getting things done that need to get done and not realizing that taking care of our well health is something that still needs to get done. And so we forget things. Everything is just, oh, I'll take care of it later, because someone or something else is always more important than we are. And that eventually becomes a big problem.
For sure. And I as I said, I'm guilty of this myself, of taking care of the long list and waiting for there to be some kind of almost semi-crisis at times to kind of jump in. So I know that there's a lot of as you said, well health, things that we should just, be doing and not waiting to have a pang of a pain or, something that doesn't feel right to, motivate us to get to the doctor. What are some of those well health checklist items that we should really be focused on?
Well, we all know that October is breast cancer awareness. And we say that and we see it everywhere, but we don't always recognize that breast care, being mammograms, breast exams, are something we actually need to take care of, even if it's not October. We don't all have to go for mammograms in October. We're not all above 40. Those of us who are not 40 and above still get breast cancer. Women under 40, the rate of breast cancer under 40 is rising. We have to take care of those women. And so doing a self breast exam is still very important. And even though it's not generally discussed, it should be. And it should be discussed even among us, among women. You chit chat with your friends or whatever, even if you're not going to do your annual physical, which you should. Yeah. It's something that we need to do. It's a very simple process. You do it in the shower, pick a day of the month or at the end of your menstrual cycle or whatever. But it's something that needs to be done, because lumps and bumps that come up and you didn't notice them before can be something. They can always be something benign. They may be a cyst or a tiny fibroadenoma, which is just like a fibroid, but in the breast. These little things may be absolutely nothing to worry about, but at least you've checked and you made sure. But they can also be something bigger or something worse. And some women just kind of chalk it up to, I'm young, there's no breast cancer in my family, forget about it. I recently saw a woman who, in the span of talking about something completely different, said, oh, but doc, there's this little thing I found the other day. I think it's been there a couple of weeks, I'm not sure. And just by looking at it, I could tell right away that it was a very advanced breast cancer. So she hadn't even noticed that there was a physical change that had happened just by looking. So simple things like that. We need to look at ourselves, look at our bodies, see what's happening, and do these casual checks. You're in the shower, you're washing, pay attention. It's a 2-second process. So things like that. That's basic wellness. Pap smears is another thing. It doesn't take long to do. It doesn't have to be painful or irritating or time consuming so much. And now it's not even a yearly process. Now it's 3 to 5 years, depending on your particular situation. Just do it. It's simple. Take care of yourself. Check things out. Let's avoid problems that can arise. Simple.
Yeah, and a lot of the testing timings have changed. I know when I went to the gynecologist this year, I was surprised to find out that I had done my Pap smear last year, and that they said, no, you don't need to do it for 3 years is the timing that they gave me. And I walked out like, is that right? Is that true? Are there any other test timings that have changed that we should be aware of, or what is the timing for some of these key diagnostics?
The mammograms are currently between age 40 and 50 are 1 to 2 years, depending on your situation and what you come up with your physician. So that is kind of up for grabs, whether it's 1 year or 2 years. After 50, it's every year until advanced age. Pap smears are no longer at age 18. They start at age 21 or when sexually active. We have to remember that some women are not sexually active when they're 21, so we don't have to do them until they are sexually active. And they go every 3 to 5 years, depending on whether we are also testing for HPV, which is the human papilloma virus. That's the virus that is linked to cervical cancer. So if that virus is not present and it's consistently not present, we can space out the tests to every 5 years until age 65. After that, PAPs are no longer required, especially if you've never had an abnormal Pap smear or if you don't have the virus itself.
Yeah.
If you have the virus, then all bets are off. Things are going to change. So those are the main two gynecologically relevant.
So what about like a cardiogram and a colonoscopy? I mean, those are two other tests that I'm guessing we probably all avoid, especially that dreaded colonoscopy, right?
The dreaded colonoscopy is still very important, and that starts at age 50, and that's every 5 years. Unless you have some issues in the family. So everything, all the basic guidelines are adjusted based on family history. And again, colon cancer it can be deadly, like other cancers. Some cancers are more deadly in a shorter span of time. We're lucky enough to be able to catch colon cancer and cervical cancer and breast cancer early enough that we can do something about it. So we really need to take advantage of the fact that we can identify early signs of these cancers so that we can prolong a healthy life. Unlike ovarian cancer, where we really don't have a screening tool yet. The BRCA blood test is available, but it's not 100%. It's not 100% because it's not something we can do for everyone. We only do that test for individuals who already have cancers in their family. It's not so it can't be used as a screening tool for the general public. So ovarian cancer, once it comes, it's usually identified as a late stage cancer. So, there are things that we cannot screen for. But breast, cervical, colon cancer, there's really no reason not to do the screenings.
Yeah.
They're simple tests. Get them done. Simple.
And what
you had mentioned pain.
Yeah.
Not waiting for aches and pains. The other problem that I see very, very often is that women do have aches and pains and ignore it. Or we've been told classically over generations that these aches and pains are normal, expected. You're a woman. Your periods are supposed to hurt. That's just the way it is. Well, that's not necessarily true. There is an acceptable level of pain, but pain is the body's way of telling you there's something not right. A little bit of cramping, first day of your period, the day before and the first day, a little bit. Moderate is not good. Maximum pain, like something that's severe that keeps you in bed or bothers you or where you have to take medication, that's not acceptable. That is not normal. So if you go on a scale of 1 to 10 and your pain is 6, 7, 8, that's not normal. If your pain is lasting more than 3 days every month, that's not normal. If the bleeding is so heavy that you're running back and forth to the bathroom every 3 hours or 2 hours, or you're faint and you're tired and you're fatigued, that's not normal. And yet we've been kind of told, your mother was like that, your sister was like that, it's in your family, that's okay, all women are like that. And we talk, oh, your cramps this month, oh, my cramps this month. We take it as a general acceptable womanly thing, but it's not.
Right.
So we've become ingrained as women to accept pain and move along. It's not. And it's not like a man cold where, okay, deal with it. It's not. And we need to remember that for ourselves.
Right.
And if you go to a physician and the physician tells you, oh, it's okay, it's just your period. No, it's not. Find another, keep looking until you find the answers you're looking for.
Well, I think that speaks to why having a women's health physician is so important, to really understand, our bodies and, how everything should be working, as opposed to, some of the stereotypes that, I unfortunately end up dealing with. So don't wait for pain. Don't ignore pain. Go get the tests done.
Yes, absolutely.
So what about cardiograms in this conversation as well? So I know that was on our list to talk about.
Cardiograms are, again, if you're getting your yearly physical done, that's going to be age related, and it's going to be based on your physical health, your coexisting conditions. So for diabetics, for people who have hypertension, you're going to start getting done at earlier ages, and more frequently, again, depending on your physical health. And it's the same with things like thyroid, getting your thyroid checked. It'll be every 3 years, every 5 years, depending on your age and your physical condition.
So getting your thyroid check, what does that entail? Some people may think that, right? So that's a blood test.
Well, yeah.
I know some people don't think about that, but I know that is something that so impacts the way our bodies are responding.
Right. Women start to think about gaining weight after menopause or during menopause, and we blame it generally on metabolism in menopause. It's true that your metabolism changes during and after menopause, and you start to gain weight with less calories because of a change in metabolism, but also it may still be that you've become hypothyroid. Your thyroid has changed. So we can't always just blame it on what we expect. You may have become diabetic. You may have, something else may have changed. So once again, it's not just a go-to that we blame ourselves or blame our bodies for what's happening to us. It may be something else. We still need to go get our annual exams done, annual physicals, think about wellness before we assume that we're okay.
Yeah. So, you mentioned we're chit-chatting with our friends, the conversations that we have. I'm thinking about the conversations we have with our doctors, right? And so whether it's when you go to your regular, general practitioner for your physical, or whether you're going to see your gynecologist, sometimes we feel like, oh, well, if there's something, they'll find it. I don't have to say anything about anything. I don't have to tell them anything, But what should we be chatting about with them? What secrets that we're carrying should we make sure that we mention, when we're, at either of those appointments?
I'm really glad you brought that up. There are a lot of things that physicians may not ask you, and you need to say, especially when you're at the gynecologist. Things like period pain. You may discuss your period and say, oh yeah, it's regular. Great. But you have to say that you are in pain. You may have to say things like your libido is low. You don't feel like becoming intimate anymore. And that's not necessarily a hormonal thing. It's very rarely a hormonal issue. If there's a problem or pain with intercourse, that is a big flag for things like endometriosis, which is very common. But physicians are not necessarily going to ask that. Physicians who are looking for endometriosis for a different reason may ask it. But if they don't, and that's something that is a problem, bring it up. Don't be afraid. Things like leaking urine with laughing, coughing, sneezing, or even when you don't know that you are and suddenly you're wet, that's something to bring up. Things that are bothering you for whatever cause, whatever you don't understand, even if they're mood changes. Mental health is something that's always overlooked, and we always think that it's something that needs to be addressed with a psychologist or a psychiatrist, or maybe it's just me. It may not be. That may be a hormonal issue. It may be something that is totally not in your control, but it may be a sign of a thyroid issue or a menstrual issue that's happening. It's not necessarily you and your situation at all. It may not be, it may be a familial issue. So things like that should also be brought up. Essentially, there's nothing that you should keep to yourself if it's happening. And never ever be embarrassed to talk to a physician. It's kind of, being a doctor is kind of like being a spiritual advisor. You tell them something, it's a secret. It's not something we go and blab in the hallways. And all physicians are secret keepers. Gynecologists keep a different kind of secret. We keep very, very personal secrets. So it's a safe place. When you go to a physician, it's a safe place to discuss whatever health concerns you're having. Be they what you may think are simple marital issues, they may not be. They may be completely physical that are reflected as a marital issue, or they may be what you think is like the urine incontinence or fecal incontinence. People who find their underwear soiled, for example. You may think that's something to be embarrassed about, but it may be a physical problem that needs to be addressed, and can be addressed. So anything like that may seem embarrassing to you shouldn't be embarrassing in the doctor's office. And bring it up, because there's only so much time that a physician can spend to check out everything. So even when we try to ask you like routine general questions, are you having any problems with your bowels? That's a general question, but it's up to you to bring it up.
Yes, that's very important information, and I'm glad that we talked about that. You said something else before that kind of sat with me as we're kind of going through this conversation. You said that we should take a look at ourselves in the mirror, naked, and kind of size up what looks different about our bodies. I'm thinking for a lot of women, that's something that we try to do the exact opposite of, right? That, we try to run by the mirror really fast if we get out of the shower and not get or wrap ourselves in a towel. Because of, maybe we're not feeling exactly the way we want to, or don't look the way we used to, or, whatever we're carrying. What are some kind of thoughts and inspirations to share with our female viewers about kind of getting past that and the importance of really taking a look at your body as you started and shared, because that could be where you notice important things for your health and wellness?
This is kind of a touchy point even for me, that a lot of women have some level of body dysmorphia. We think we see something that isn't really there. We always imagine, not we all, but a lot of women will imagine an extra 50 pounds that are not there. It doesn't matter. What really matters is we need to not look at what we think our shape is, because that's not the issue right now. When you look at what is different, not how gorgeous you think you would be in a bikini, not what someone else should or would think you should look like. That doesn't matter. You are who you are. Accept that part, because that's who you are. That's great. No two sides are the same. Your both hands are not equal. They're not perfectly the same. Your feet are not perfectly the same. Your breasts are not perfectly the same. One side is always bigger than the other. Fine. But they shouldn't be drastically bigger. You're not going to wear a size 3 shoe on one side and on one foot and a size 11 on the other. Right? I mean, one might be a little bit bigger than the other, but not a whole lot. And it's the same with arms, legs, thighs, breasts, all the same. But you need to look. Is there something sticking out that shouldn't be? Is there a dimple that shouldn't be there? Are there moles that are growing or changing or different colors that they weren't last year or are changing over time. All of these things are the little picky details that we need to pay attention to. And that's the observation part. Okay, so you're gaining a little weight. We work on that separately. If you're gaining a lot of weight quickly, that's a problem. If you're losing a lot of weight quickly, that's also a problem. So we don't want to do either. Either one could be a sign of a problem. So we need to stop running across the mirror and kind of hiding. Get used to it. It's you. Love it.
Well, I'm so grateful that you've been so open and honest with us. And, I know that as I started and shared, I'm guilty of this, as so many other women are, that I sometimes just wait for it before I deal with it, and always take care of, the kids, my husband, my mom, everyone else who needs something. But it's such an important wake-up call to be having this conversation with you. And I hope all the women watching are taking it to heart. One last question that I'm sure is on a lot of people's minds. We've all been kind of living, and trying to social distance and kind of quarantine for a piece of, many months. And now there's people venturing out a little bit more. Is it safe to go to the doctor right now? I mean, is it something that we should be doing, or should we only do it if it falls into this category? And if we fall in this category, wait till things are better? What's your feeling on that?
It is safe to go to a physician's office or a hospital right now. Hospitals and doctors' offices are screening on your way in. Everyone here is wearing masks and checking temperatures, and it's the best we can do. It's a whole lot safer than grocery shopping, where not everyone is wearing a mask.
Yeah.
And definitely they're not screening for temperatures. So yeah, you are safer safe going to a hospital, and safer than you are in the general public. And that includes for annual physicals, because that's the place where you may catch something that is life-threatening. Obviously, if you're sick, yes, you need to go. What I learned actually just yesterday is that there are offices that are screening for COVID, depending on your symptoms. They're screening you before you set foot in the hospital, in the practice, in the establishment, because there are places that are doing the very rapid. That's 15-minute, kind of like the flu nasal swab, and they're doing that before you get in. So if you have those symptoms, you don't go physically into the office. And of course, there's telehealth. Telehealth used to be a rare event, only for certain kinds of people who were immobile or couldn't get to a hospital or whatever. And now we all do telehealth. So someone who does have symptoms of respiratory infection or fatigue that's new onset, or there's certain symptoms that if you have those, we automatically send you to a telehealth appointment. Even if you had a physical appointment with us and then develop these symptoms, our practice, for example, will call and check with you the day before your physical appointment. And if you have these symptoms, we transfer you to a telehealth visit first, so that you don't come into the hospital. So people who sound like they may have COVID don't get to come in. People who have fevers at the door, same thing. I'm sorry, you cannot enter. You go through a different pathway, get your COVID test, and then we'll, if you're negative, then you can come in. And that's the same for surgical procedures. I'm sorry, if we cannot prove that you are negative, you can't get into our operating room. And, unless obviously if it's an emergency surgery, then we take a whole different set of precautions. So it is safe to go to the hospital or to the doctor's office. And not only is it safe, it's very important to take care of your physical health, mental health. I can't really stress that enough, that this is not something to forego until things get back to normal. because we have no idea when that will be.
Yeah.
Numbers are spiking again. And it's not something we can just wait for. And I also want to point out that October is not just Breast Cancer Awareness Month. It's also Adenomyosis Awareness Month and Domestic Violence Awareness Month.
Yeah.
So, and both of those affect women more than anyone. Domestic violence is actually a huge cause of pelvic pain in women. So when you do go to a physician, if you're not mentioning pelvic pain or whatever else, other chronic pains and aches, and a physician may not go down that road with you. But if you feel unsafe at any point, this is something, again, that you can mention to a physician who can get you hooked up with social work, or can get you in touch with a counselor or a therapist or someone who can help you in the situation you're in, depending on what that situation may be. And as far as adenomyosis goes, that is one of those diseases that is very much underdiagnosed, whether it's adenomyosis or endometriosis, and both of those are related to your menstrual cycle, the amount of pain, and the amount of bleeding. And we can manage them, we can treat them, we cannot cure them, but they're very, very, very common and always overlooked by the general population, because you're supposed to have pain and bleeding. That's what everybody's always told us.
Right.
Unfortunately, women do end up visiting, on average, 8 to 10 physicians before they actually get a diagnosis. And that's partly our fault as physicians, and our fault definitely as a community that has perpetuated this idea that it's okay to have pain.
Yeah.
So keep those in mind.
I'm so grateful. It was such a great discussion. For those of you watching, if you'd like to connect with Dr. Rizk or learn more about her practice, learn more about Newbridge Medical Center, you can follow them on all of their social media platforms. You could check out their website. And, again, just this conversation alone reinforces why it's important to have a really good women's health doctor, because, she can look at you, or he, but a women's health doctor can look at you holistically, and, not just, for the one thing. They get how it all snaps together and makes you, one being. But what a gift to be able to spend this time with you today, Dr. Rizk, and thank you for sharing so much food for thought. Ladies, we've got to push ourselves up to the top of that list. Don't wait for the aches and pains. Don't ignore the aches and pains. Before you go to bed tonight, take a good look at yourself in the mirror and embrace the love that you should feel for your vehicle that gets you through and does so much for you. And make sure you're following up. It is a safe time, clearly, thanks to what Dr. Rizk is sharing, to still go and take care of our appointments and stay on top of all the important ones. So with all of that, and also shout out to Newbridge Medical Center, during this entire time of COVID, they have been everywhere with their mobile van. They've been doing significant amount of testing in our community, and, really have been a leader in the state and nationally in the work that they're doing, thanks to the great care of doctors like Dr. Rizk and their wonderful CEO. Really, we're very lucky to have a medical center like this in our community. It's unique, and it does show how they care about the community just by watching these kinds of practices that they engage in. So with all of that, for our viewers, look, I know there's ladies in your life that could not be watching right now because they're handling all the stuff on that list. Please make sure that they watch this. You can share it with them. You can share it to your Facebook page. You can send them a link, message it to them. It's really important that women hear this discussion and that women are taking care of themselves. So please make sure. We have links also noted in the comments to Newbridge Medical Center in case you have any questions there as well. And I'm so grateful to everyone who did watch. So tomorrow, we hope that you can join us. I'll have Sarah Hiller-Berson on, who is with the Center for Purposeful Aging. And we're going to talk a little bit about some of the misconceptions about aging, just how you should have a good women's health doctor. You should have a good geriatric care doctor too, when you're kind of getting into those ages and stages of your life. And on Thursday, I'm excited to continue our Share the Mic Now project, and looking forward to talking with Vita De Leon, who is a poet and a member of our Bergen County community, and happy to talk with her about her life experience. It's not too late to sign up for the 21-day racial equity and social justice challenge. We will have the link here in our comments. We do encourage everyone to work to develop more effective social justice habits, particularly with those around race, power, privilege, and leadership. We do believe that we will be able to eliminate racism if we bring everyone together like-minded and work together. So please join us and learn more there. And election day is now, folks. We're coming down to the end of the line of November 3rd, but you don't have to wait until now. Then you should have your ballots. Those of us who are from New Jersey, make sure that you are getting your ballots in. You can drop them in your mailbox. You can drop them in one of the drop boxes that exist. You can drop them off at the Board of Elections, at your poll locator. And if you have any questions about anything related to voting, go to vote.org. And we wish you a wonderfully healthy, fabulous day. Dr. Rizk, thank you again for spending this time with us. I know that we all gained so much. We appreciate you sharing all. And we appreciate having you in the community and sharing so much of your knowledge with us today. Thank you.
Thanks so much for having me. It was a lot of fun.
Bye, everyone. Be well. We'll see you tomorrow.